Hello nurses and future nurses, welcome back to my YouTube channel, and on today's episode of Nurse Clement B, I am going to teach you on how to administer medication in the ear canal, that is in the middle ear, right? So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B, and I thank you, I appreciate you for your likes, shares, comments and for your subscription, right? Thank you very much. Thank you for your support. I am not taking any for granted. And in case you want me to do any procedure that you are in need of, please, you can chat me up on Nurse Clement B and or drop it at the comment section and I will attend to it. Do not forget that I have lots of videos on this YouTube channel. Also go there and check any procedure at Nurse Clement B. It will just come up. So now, before you start this kind of procedure, you have to identify your patient, right? So now let's go and identify our patient. Very important, so that you not perform procedure on the wrong patients, right? Good morning, my name is Nurse Clement and I'm here to administer your medication, that which the doctor prescribed for you, and I'm going to make sure that it's going to be very simple procedure, right? So can you please tell me your full name and date of birth? Okay, you are Mr. Christian Ali. All right, what about your full date of birth? 15th February 1990. All right, so you identify your patients, and of course some hospitals, the patient's name tag and identification is on their wrists, right? So depending on the hospital that you are, depending on the principles guiding those identification, right? So now that we have identified the patient, I have to, like, ask the nurse, take an informed consent from the patient by explaining the procedure. So now I am here to administer your medication, and I'm going to put the medication, is a liquid-like medication, into your ear. You're not right deep inside your ear, but into your middle ear. Is that okay? All right, so please, can you stay put and let me go and bring my supplies. So I'm going to set my requirements now to carry out this procedure. So I have my otoscope. Of course, I want to view the patient's ear to make sure that there are no impacted wax that will block the eardrop, right? And I am going to use, if there is any, I'm going to use this cotton bud to remove the ear wax from the middle ear of the patient. And I have my prescribed medication here. I have my cotton wool and I have my disposable latex glove here. So before I do that, let me go and perform hand hygiene and come back and don't glove. Just sit back, do not go away. Wait till the end. I know you love this procedure. So now that I'm done performing hand hygiene and I'm done in my glove, right? So it is time for me to examine the patient's ear, right? So I'm going to examine the patient's ear using my otoscope to see if there is impacted wax, and also observe the pinia of the patient to observe if there are anything on the patient's ear. Now I have to pull my patient ear to put the otoscope to view if there is any impacted wax. Yes, I'm viewing the inner ear of the patient. So now I assume that there is an impacted wax in this patient's ear. Some impacted wax close to the ear opening, so that it will not obstruct the eardrop going into the patient's middle ear. So I will use this Q-tip, right? I'm going to use this Q-tip to remove the impacted wax. So you have to be very careful when you're removing it, so that you will not push. Instead of removing it, you will not push the impacted wax rather inside, or any particle inside. So you have to be careful when removing the particles or the impacted wax. So now I have to pull the patient's ear pinia like this, and then try to remove. Be careful so that you will not push ear, and I carefully remove it so that I can have easy access, and I discard it inside this receiver for use items. Remember, before you administer any medication to patients, you have to observe the 5 R's, right? The 5 rights: the right patient, the right route, the right medication, the right time, and make sure that you record it, right? So the patient has been placed on this, check the prescription of the patient, and the patient has been placed on clotrimazole ear drop, and I'm going to instill this ear drop into the patient's ear canal, right? So come with me to my patient's bedside. As you open the medication this way, and then you drop the cover. If it's an adult, you pull the air. So if it is an adult, you pull the pinia backwards upward. This helps to straighten the ear canal, and then you drop it this way, 2 to 3 drop, and we allow it to go inside the ear, right? We allow the patient to stay in this position for a while. Then you use your index finger, this way, and then press the tragus, like massage it for like 8 to 10 times. This helps to allow the medication to go right inside the ear canal, right? So you press it like 8 to 10 times. After which, you can also put this cotton wool by the ear. Do not push it right inside the ear, and make sure that the patient maintain this position for like 5 to 8 minutes. So now that I'm done performing this procedure, I have administered the medication. So it is time for me now to discard used equipment by rearranging it. If it is during OSCE, of course you discard used equipment by rearranging it, right? Because next candidate is coming right behind you. So discarding of your supplies is very important. So I'm going to remove my glove and perform hand hygiene. So follow me. Let's go and perform hand hygiene. Now that I have performed hand hygiene, it is time for me to record the procedure. I document 3 drops of clotrimazole at 10 a.m. and now I am done. If it is in the system, of course you impute it in the system, right? I hope this video is helpful. Thank you for watching this video till the end, and thank you for staying with me today, and thank you for your like, share and comments. Do not forget to share to various groups and student nurses, midwives and staff nurses, right? Thank you very much. Bye.